omo hwe say enkai mpo ansa na abefo plane ubefo wiemhyan aba no ubedi kan atare ewo ho ebi abe 72 hours and say be 3 days cry ahead PCR test anka say negative and sample no wafo na afo na be do akwan e be fa so yasna test wo kotoka no anya kra be 15-20 minutes maximum na nka yesa anya results no eno so omo ye eho hyeye omo ye ni na awie na omo de to mampani anim na ba no a ye be ru say eno nti target of 1st September na ye de hyeye no e ade a ye betumi edi so tiano de ye betumi aka ewo ho. There's a question about enforcement or whether the law has been relaxed. So you've seen the data on compliance so far. The Ghana Police Service and the local authorities are responsible for helping us enforce the executive instrument which makes it mandatory to wear the face mask. The feedback given us is not very different from what the Ghana Health Service gives us, that a good number of people have the intention to use it. Somewhere sitting around 80% thereabout have the intention to use it. But in terms of those who are using it properly, hovers around a little under 50%. The approach that they have adopted is more occasion and more compulsion of people to wear, particularly when you have it but you are not using it appropriately. And so, though they have the power to arrest and even prosecute, they have elected to use, you recall some time ago I told you about the purposive approach. The purpose is to ensure that people are wearing it. And so they elected to use the purposive approach in rather encouraging people to use it and to use it appropriately, and they will continue so to do. But I also ask you not to renege or to lower your standards for education. Colleagues in the media, we ask of you not to assume that because the active case count is 1,723, it's come down, even the amount of airtime that you were putting into encourage people to wear the mask, you also lower the standards. We encourage you to keep doing that. As you do that, as the police and local authorities do that, as we all encourage, if we get some more compliance, it is helping us to cut or to bring our R0 rate down a bit more and to make some gains in this enterprise. The other question is about why we have excluded the security services from the unification of pensions and whether or not that is not discriminatory. That is discriminatory. That is positive discrimination. The reason is that Cabinet took notice of the peculiar nature of their tasks, risks, exposures therein, and was a view that they be allowed to stay on their old pension programs and therefore be excluded from the unification of pensions under this act. And that's why the minister is being asked to take the necessary steps to commence the amendment process. You recall that earlier the Interior Minister had mentioned publicly that no, they would not be injured. But Cabinet had to now give permission for the amendment of the Act in Parliament, which is what has happened, and which is what I've been instructed to announce to you this morning. So, Doc, if you join me and deal with about 4 questions of Ghana Health Service: disposal of COVID-related waste, what the Ghana Health Service makes of the risks associated with political activities as we are beginning to observe. What do we say about reports that there could be after effects in terms of people's organs, etc.? Do we have data on analysis of the death? Are they all still predominantly persons with underlying health conditions? And do we have data on persons with disabilities who may have suffered from COVID? Your take.
Thank you very much, Honorable Minister. On the activities and the compliance, I think we continue to encourage and educate people about the importance of applying the protocols of wearing a mask, social distancing, and we also believe that the individual has that, you have that power to exercise that, and then if we all do that actively, we'll be able to avoid that. And so we'll continue enhancing their education and also ask organizers to ensure that there is some education and some purposeful alertness of people to be able to comply to those protocols. But it's not just for political rally. We have also observed something that is happening. We in Ghana are not playing football, but we have a lot of people who go and mass up on television watching Champions League. Okay, and so it is another area that we want to bring to the attention of people, that even in that area, people must ensure that the mask wearing and social distance is done. Otherwise, we might as well start playing our own football. So very important that we also look at that, so that anything that brings any mass gathering, we must ensure both the organizers and the individual must take that responsibility to ensure that they are applying those things. Because if you save yourself, you protect everybody else. We are very impressive survey exercise that we did as far as the waste disposal. The waste disposal of the PPEs, as we have demonstrated, especially a mask, was how you remove it and disposing them all in a bin, and then subsequently burn. So it's not supposed to be just put in a bin and sent away. The hospitals are supposed to dispose all such contaminated materials through incinerators. After you need to put them in safety boxes and then incinerating them. We continue to enhance our IPC, and that if there are any facilities that are doing that, we continue to encourage them to stop that. But broadly, what they do as these special wastes are put away. But the thing is that because it's a general use now, we need to intensify education, especially on the disposal, and that you move them and put them in a bin and then you burn. You don't just put it in the open waste. The issue of sequel, I think, as you know, this is a new disease, and we also continue to study the after effects of people who have had COVID. There are several reports of people having some residual challenges in their lungs, etc. But this is still something we continue to study. And so as we study, we continue. We are also in Ghana, we follow these people up. Noguchi also doing some immunological tests to see how are people responding to that. And so continue studying that, but we know for a fact that there is some sequel. There are people who continue to feel tired after. So we continue learning to see exactly what is going on whilst we prepare to respond to those areas. Comorbidity, hypertension, diabetes still remains the highest comorbidity, and that's almost 85% of all the deaths have this comorbidity associated with it. Has not changed. We have not deliberately done any assessment of how many people are disabled, but the data is there, and we should be able to tease it out and share whether there are the number of people who have any such disability and also had COVID. Thank you.
Thank you. We'll take our final batch of questions. Final batch of questions. Are there any takers? Yes, sir. Please step forward. No, yes, you. Maybe you give us our final question. It appears the first batch exhausts a good chunk. You have a question as well? Okay, please step forward. This will be our final batch. Are there any takers?
Mr. Director General, I think your response to my question, was a bit different. I was asking, there are so many of the waste pickers, the tricycle users without protective items, and a lot of people don't even know how to keep the waste in their homes. They mix it with general waste. And so if these waste pickers come, they just lift everything with their bare hands, they get exposed. Are we looking at an awareness creation on TV? You recommended open burning, and people could do open burning, and that could have implications for human health and the environment as well. So what exactly are we doing?
Yes, sir. Your question.
Yes, I think PC and Nanasa from JoyNews. So, two questions quickly. First, on our declining rate of active cases. We now have less than 2,000 cases out of the general, and some are saying that this is due to reduced efforts in contact tracing and testing. How do you respond to such claims? And the second, we've been made aware already that the Ghana Health Service, and the Minister alluded to that for the CAN journalist, that we are doing simulation tests in order to know whether or not to open now. But how far on those simulations so far? Thank you.
Did you?
Okay.
I think the first question is about whether we are considering some sort of engagement to help people better dispose of COVID waste. And the second one is about how far we've come with the solutions.
Okay. All right, thank you very much. My answer was educating people on how to dispose of it. And once that is done, this issue of waste takers being exposed will be cared for. And so we intend to encourage and do the campaigns to ensure that people don't do that. Whilst we also encourage the waste takers, as it should be, to have what we call primary prevention, and that you also wear your protective gear to be able to look at that. So that is something that we can do. We cannot just get up and start saying, okay, from now on, we need to start telling people exactly how it should be done so that we can reduce exposure. There is nothing like reduced contact tracing. Our contact tracing is that if I am positive, you test my contacts, okay? If you have 2,000 positives, you are likely to have more contacts to follow than if you have 100 cases. So it's not like you have a certain number of contacts you must always look for. It depends on the number of contacts you have to follow. And also those who have symptoms that will be tested. So that's what determines how many contacts you follow. We can also look at risk groups, which we continue to do, and add them up. So that is so. There's no magic number that you must do, for example, 5,000 contacts or so a day. It depends on what you had the previous day and what response you are going to get. In the area of, so nobody has stopped contact tracing. If you have positive and have 4 contacts, unlike before when we wait for those 4 contacts to fall sick or have symptoms before we test them, now we test them immediately, and that's what has given us the large number of tests that we are doing. In terms of, I don't remember hearing opening of borders. I thought I heard about opening of the airport.
Opening of the airport.
So not at the airport. And so we are working with them. A lot has been done at the airport in terms of reducing congestion, raising shields to ensure that there's no contact. Now what is left is how do you test people when they arrive without causing a clog? And that is what we're looking. Once we'll finish and we are with the airport authority and the other agencies, if we are satisfied with that, then we will also inform the government about our recommendation, and that's what we'll do. So we are currently working on it, and subsequently, once everything is installed, we do some simulation to look at how long does it take, and then we'll report on that. I think, Mr. Lasso.
Thank you, Dr. Baji. So colleagues, just to touch on a few things, and then I will do the security examine in Chi. Just to elaborate a bit further, the contact tracing is a product of active positive cases. So for example, if you have 100 cases, and each one of those 100 cases has about 10 contacts, you test about 1,000 people. If your active cases drop to, let's say, about 50, and each of them still has 10 contacts, you end up testing about 500 people. Have you deliberately refused to test more? Have you deliberately reduced your testing? No, you haven't. But it is a function of your active cases or your positive cases. And so please help us to explain that to the general public accordingly. The second matter is that, for example, the data suggests that through the Kotoka International Airport, you have about 3,500 arrivals a day. Total of about 7,000 passengers going through the airport, about 3,500 of them being arrivals. So how do you pace them out in such a way that you can test every airline as it lands? Is it 100 or 200 people at a go? Quickly test them, let them know their results, and then those who maybe, unfortunately, if they are positive, have to go for treatment at some treatment center, the rest can go. That is the kind of work that they are doing, and when they are done, they will be able to report on it for a decision to be made accordingly. I just want to remind you that the big number for today is 1,723, and the idea is to keep working to bring it down by ensuring that positive cases don't increase or new cases don't increase while we quickly try and step healthcare for those who are positive and bring the number down as quickly as possible. So, colleagues in Chi, let me take the cabinet decision for you. Mampani, any cabinet, etnas juade, na nkoma omudi no baako eye pensioner ye bampo e Ghana ha say police, immigration, fire service, prison service, any one who security and intelligence agencies no pensioner ye de maom ye nyere say 2008 Ghana Aban Shemra Act 766 National Pensions Act na mra no say o se Ghana dwuma efo nyina o ma ye aban nwuma nyina no ye the unification of pensions ye do nyina share pension ba ko ase na titiru ye bambofo no police, immigration, national fire service, prison service, asrafo and no security and intelligence agencies no onom no na omo different pension program ase nti na ebi mo esusu adwendwen hu se ye de on ba be hye sa unification of pensions ya se wo act 766 na se ana cabinet di nkomo no adwen nyina ko benkum de bi wo mo no eni so mo beka unification pensions no eho na omo pension da na wo cap 30 ne other ones na wo ho na omo hyase no omo nkoso enhyase omampani Minister for Employment and Labor Relations say ohwe na ontana mo na amendment wo say ye wo parliament mra na wo say amend wo parliament act 766 no yetumi amend no omo so sa mra no womo so ebi nti nkomo kakra ewo ho eno no ye ba ko bisa say eden na cabinet hwe nti a adwen no course a ehwe adwuma ko mo ye ene protocol say risks associated with it and the peculiar nature of omo bambo adwuma no eno na mpani hwe ya omo de etu sa anamo no so colleagues, we'll say thank you. We'll leave it here. Rolling on Tuesday, now that all the holidays back and forth are over, on Tuesday, we will re-engage for a minister's briefing. And then on Thursdays, the minister's press briefings will continue and include the COVID update. So the COVID updates will be included in the Thursday briefings. Both the briefings will be on Tuesdays and Thursdays. And Tuesdays we'll deal with general matters. Then on Thursdays, the COVID briefing will be included. Thank you very much.